Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test. Listening Test. Part A. In this part of the test, you'll hear two different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a nurse talking to a patient called Alex Martin about managing worsening asthma. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mr. Martin. How are you feeling today?
Good morning, nurse. I've been having a hard time breathing lately, especially when I exercise or during the night. I've had these issues before, but it's getting worse.
I'm sorry to hear that. When did these symptoms start to get worse, and have you experienced any wheezing or coughing along with the shortness of breath?
It's been about a month now. I do notice some wheezing, and there's also a dry cough, mostly at night. I didn't think much of it at first, but now it's interfering with my sleep and activities.
I see. Do you have a history of asthma, or has anyone in your family been diagnosed with asthma or other respiratory conditions?
Yes, I was diagnosed with mild asthma when I was younger, but it hasn't bothered me much in the last few years. My father also had asthma, and my younger sister has it as well.
Asthma can be hereditary, and it sounds like your symptoms might be related to it. Asthma can flare up or worsen due to triggers like allergens, exercise, cold air, or stress. Have you noticed anything specific that triggers your symptoms?
I've noticed that exercise and cold weather seem to make it worse. I've also been around a lot of dust recently because of some renovations at home, and that's when things really started to get bad.
Dust can be a strong trigger for asthma. Based on what you've described, it sounds like your asthma may be worsening, but we'll need to do a few tests to confirm. I'll get the doctor to examine you shortly, and we'll conduct a spirometry test, which measures how well your lungs are functioning.
What's involved in that test?
Spirometry is simple. You'll be asked to take a deep breath and then exhale forcefully into a machine that measures the airflow and lung capacity. It helps us determine if there's any obstruction in your airways, which is common in asthma.
That sounds straightforward. I hope the test gives us some answers because I'm worried about how much worse it's gotten.
It's good that you came in before it progressed further. We'll also check your oxygen levels and listen to your lungs with a stethoscope to see if we can hear any wheezing.
Good morning, Alex. The nurse has given me an update on your symptoms. It sounds like your asthma might be acting up, but we'll confirm that with the spirometry test. In the meantime, can you tell me more about how often you're experiencing symptoms and how severe they are?
It's been happening almost daily now, especially during physical activity or at night. I've had to stop exercising, and I'm waking up several times at night because I can't breathe properly. It feels tight in my chest.
That must be uncomfortable. Based on your symptoms and history, it's likely that your asthma has become more active. We'll do the spirometry test today to assess your lung function. I'll also prescribe you a quick relief inhaler, which contains a bronchodilator. This will help open up your airways when you have an asthma attack or feel short of breath.
Will I need to take the inhaler all the time, or just when I feel breathless?
The quick relief inhaler should be used when you feel symptoms coming on or during an asthma attack. However, based on the severity and frequency of your symptoms, you may also need a daily controller inhaler. This contains corticosteroids that reduce inflammation in the airways and help prevent symptoms. We'll see how your spirometry results come back and decide on a long-term treatment plan from there.
That makes sense. I'll definitely use the quick relief inhaler as needed. Is there anything else I can do to manage the symptoms?
Yes, there are a few lifestyle changes that can help. Since dust seems to be a trigger, try to minimize your exposure by keeping your living space clean and using air purifiers if possible. Avoid exercising in cold air or during high pollen days, as these can trigger your asthma. If you can, stick to indoor exercises until we get your symptoms under control. Managing stress can also help, as stress can exacerbate asthma symptoms.
I'll definitely try to reduce my exposure to dust and be careful about exercising outdoors. Should I avoid certain foods or environments?
While food allergies can sometimes trigger asthma, it doesn't sound like that's the case for you. However, avoiding smoky areas and places with strong odors, like paint fumes, would be wise. Also, stay hydrated and avoid cold drinks that can irritate your throat and airways.
Thanks, Doctor. I'll make those changes and use the inhaler as prescribed. I'm hoping to get back to my normal routine soon.
You're welcome, Alex. With the right treatment plan and a few adjustments, you should start feeling better soon. We'll keep monitoring your condition and make changes as necessary. If your symptoms worsen or you have any concerns, don't hesitate to reach out.
I appreciate that. I'll follow up after the tests and let you know how things are going.
Sounds good. Take care, Alex, and we'll see you soon.
Extract 2, questions 13 to 24. You hear a doctor talking to a patient called Sarah Johnson. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Sarah Johnson. Please come in and take a seat.
Thank you, Doctor.
I see from your records that you recently underwent surgery for a leg fracture. How have you been feeling since the procedure?
Overall, I'm feeling better, but I'm still dealing with some pain at the surgery site. The area around the incision is quite sore, and there's some swelling in the surrounding tissues that hasn't fully gone down.
It's common to experience discomfort and swelling after surgery. Can you tell me more about the pain and swelling? For instance, when does the pain tend to be the worst, and how would you describe the swelling?
The pain is usually worse in the evening and after I've been on my feet for a while. It's a deep, throbbing pain that seems to radiate from the incision site. The swelling is persistent throughout the day, but tends to get worse as the day progresses. It seems to reduce somewhat when I elevate my leg, but it never completely disappears.
I see. It's important to manage the pain and swelling effectively. Have you been following the post-surgery instructions we provided, and how are you doing with your physical therapy?
Yes, I've been diligently following the instructions and attending my physical therapy sessions regularly. My physical therapist has been helping me with exercises to improve mobility and strength. Despite this, I still find it challenging to move my leg freely. The therapist reassures me that some discomfort and swelling are normal during the recovery process.
That's right. Recovery from surgery can vary from person to person. Have you noticed any changes in the incision site, such as redness, increased warmth, or any unusual discharge?
Yes, there is some redness around the incision, and it occasionally feels warmer than the rest of my leg. I've been worried it might indicate an infection, although I don't have a fever or any other systemic symptoms.
It's good that you're monitoring these changes. Redness and increased warmth can sometimes be signs of infection, but they can also be part of the normal healing process. I'll need to examine the site to determine if there's any infection or other issues. Additionally, I might order a follow-up X-ray to check the alignment and healing of the bone.
I understand. I'm keen to make sure everything is healing properly. The discomfort and swelling have been a bit discouraging, and I just want to ensure there are no complications.
That's a sensible approach. During the examination, I'll look for any signs of infection or complications and assess the overall healing progress. If needed, we can adjust your pain management plan or suggest additional strategies to alleviate the swelling.
I appreciate that. I've also been concerned about how long it will take to get back to my normal activities. Is there a typical time frame for recovery after this kind of surgery?
Recovery times can vary, but many people start to see significant improvements in mobility and reduction in pain within a few weeks to a few months. It depends on factors like the severity of the fracture, the type of surgery performed, and how well you're following the rehabilitation plan. The goal is to ensure that the bone heals correctly and that you regain full function of your leg.
That makes sense. I'm also curious if there are any specific activities or exercises I should avoid during this period to prevent any setbacks.
Yes, there are a few activities you should avoid, particularly those that involve heavy lifting, high-impact movements, or any exercises that put excessive strain on the healing leg. It's best to focus on low-impact exercises that improve range of motion and strength without putting too much stress on the leg. Your physical therapist will provide guidance on which exercises are appropriate for your stage of recovery.
I'll make sure to follow that advice. Is there anything else I should be aware of during my recovery?
Just continue to monitor your symptoms closely. If you experience any sudden increase in pain, swelling, or if you notice any new symptoms such as fever or significant changes in the appearance of the incision site, make sure to contact us immediately. It's also important to keep up with your follow-up appointments so we can track your progress and make any necessary adjustments to your treatment plan.
Thank you, Doctor. I'll keep an eye on those symptoms and stay in touch if anything changes. I'm looking forward to getting back to my normal routine.
You're welcome, Sarah. We'll work together to ensure a smooth recovery and help you get back to your usual activities as soon as possible. I'll arrange for the follow-up X-ray and schedule your next appointment. In the meantime, if you have any questions or concerns, don't hesitate to reach out.
I appreciate all your help. Thank you again, Doctor.
You're very welcome. Take care, and we'll see you soon.